Hello, this is Endovascular TV. We are inside Thela 2015. We have the opportunity to have an interview with Dr. Lawson. Dr. Lawson, he has a very long experience. Looking into his profile on LinkedIn, I could read that he performed more than 1,000 treatments per year. So it's a huge activity. So Dr. Lawson, welcome.
Thank you.
So I would like to know if you can give us a short summary of your background in your activity as a vascular surgeon.
Yes, I'm right on age. I'm 67 at the moment, and I have a long history. I actually did general surgery first. It takes 7 years in the Netherlands, and then specialized in vascular surgery. But I did everything, all the big work. But I was always interested in varicose veins, especially when the new techniques came along. It was more sexy than it was in the past. And my last 10 years I completely specializing in varicose vein treatment.
Okay, because of your experience, a very dilated experience, you have decided to treat your patients with endoluminal techniques, endovascular. Yeah. Which are the main reasons for that?
The main reason is that that varicose veins is not really a serious disease. I mean, people don't die from it. So you mustn't do big surgery, what I did in the past. All kinds of stripping procedures, patients had a lot of pain, bruising and everything, and they had to stay at home for 7 days or 14 days, whatever. And with these new techniques, you can do it actually in an office. You can do it on the local anesthesia, and patient can back to work the same or the next day. So that's an enormous improvement.
So you've mentioned an interesting thing that these kind of treatments you think that could be done in an office. So I would like to know more things about the new product, about the thianochrilato, about Benacil. What do you think that Benacil offers to the patient in front of the other techniques?
Yes, I think the results will be about the same. I mean, thermal ablation with laser or radiofrequency is that good that it's very difficult to improve it. So Benacil just offered that you don't have to give anesthesia just for the puncture. You give a little bit anesthesia, but you don't have to give tumescent around the treated area. And a lot of patients have a lot of problems with that. It depends a little bit on the country. I mean, in the Netherlands, we live a little bit in the north, so the patient have pain, but they don't express it.
No.
But if you go more southwards, for example,
in
Spain,
Spain,
and then they start crying, and then you get nervous, because they are crying, and then you have a problem. So with Benacil you don't have it because patients don't have pain.
Okay.
That's the first thing. Another thing is that thermal ablation is always a risk if you don't do it properly, if you don't give enough tumescent, if you go too low in the leg, then you have a chance on neural damage, nerve damage, and you don't have this Benacil. So that's another advantage.
Okay, so yesterday we were chatting in a dinner about the fast track procedure. So, which is your opinion of the fact that in a varicose veins you only treat the saphenous vein without treatment of varicosities or the tributaries? Which is your focused interest?
The point is that we do phlebectomies as well, but not in every patient. So if you have a young patient with merely cosmetic problems as well, then we do phlebectomies because it's very easy, you have always a good result, and patients are happy. But we treat a lot of older patients or just have a lot of complaints and serious disease. And then triple ablation is actually the first thing you have to do. If the complaints are disappeared after the treatment, they don't give a damn about these varicose veins. They are not interested. They just want to have no pain anymore. And in that case, we mostly treat them with truncal ablation. We wait for 2 weeks and then we look again. And if there are still some varicose veins who are symptomatic, then we give some foam to treat them.
So you wait for the involution of the tributaries. In that case, you treat with foam.
Yeah.
Okay.
Mostly.
And we can do it a lot of things with Safena. We can boil, we can electrify, we can stick. What's next? What do you think? Because the world doesn't stop.
It doesn't stop, but the point is that we're looking farther. What I mean, if you do truncal ablation or you do surgery or whatever, you have always, in a lot of patients, you have progression of disease. And you have to look at your treatment to make it even better. And that's, so first, patients don't have symptoms, you treat the disease in the first place, but then after a while, patients get progression.
And you think that varicose veins treatment has to be done in the future in the office? Or you
Yes,
think,
I don't go back. I don't go back to the...
Absolutely.
No, I mean, it's also very nice to do because you always have a lot of contact with the patient.
Yeah.
And they don't need general anesthesia. I mean, it's expensive and it's potentially dangerous. So why should you do it?
Okay, so thank you very much. So thank you. It has been an honor to have Mr. Lawson with us. Okay, I will wish you all the best for the future. Thank you very much.
Thank you.